All right, everyone, thank you for joining us back on Deigni Plastic Surgery. I am here with my lovely patient, Jada. I'll let her introduce herself, but I just want to say she is 3 months out from her beautiful drainless tummy tuck, and she has graciously accepted to sit down with us and answer some questions, share her experience about how the process was, and give us some tidbits about how to prepare for plastic surgery, how things are, and of course everybody has different experiences, so we're very grateful that she is happy to share those experiences with us, and we hope you enjoy this. So Jada, tell us a little bit more about yourself and kind of like what made you decide to have plastic surgery.
Okay, so I'm Jada, I'm from Florida, and I had been contemplating surgery, tummy tuck, for many years, but I was just stuck on the fence. And as I'm stuck on the fence, the years are going by, I'm getting older and older as I am of a particular age. I'm not a spring chicken, but it's still something that I've always wanted to do. And I ran across you on TikTok, and you caught my attention. Because first of all, you were talking about tummy tucks, and it's like, okay, let me listen in a little more. And what really drew me in, when you talked about a drainless tummy tuck, and it's like, wait, what is this drainless tummy tuck? And I listened, then I started following you and listening and hearing more and more, and just felt the caring from you and how you really put your patients first. And I drew in a little closer, and I finally reached out to your office and started talking with Miss Linda about the possibilities of getting a drainless tummy tuck. And I did it.
Yes, you did.
I flew in from Florida and met with your staff and met with you, of course, and it was just like, my TikTok friend.
Yes. Now, remind us, and I love how the conversation is going. We started the process with a virtual consultation, or with you flying in to come and see us?
No, we started with the virtual consultation.
Correct.
And I got a lot of questions answered because that was my personal time with you to be able to ask some questions that were unique to me.
Yes.
And I was feeling really comfortable with everything that you shared with me, and we started the process.
Yes, we did. And you sent pictures for that, for us to be able to start that process, so I could actually understand, one, what you were wanting to have done and how we could help you. Yeah,
absolutely.
I'll have to find those pictures because I forget. You look amazing and just stunning, and I forget what you looked like before.
I didn't.
So we started that process again for patients who are out of state or even out of town with the virtual consultation. Then you flew in and you had already planned your whole stay, your surgery, and how did that go?
Short of amazing, it was amazing, really. I met at the office, met with Miss Linda, got to meet you in person, like I said, and got prepped for the surgery. No problems, again, a little scared. And then I do recall on the day of surgery at the surgery center, when you walked in, it's like relief, it was because you put me at ease again. And I said, have a little anxiety. And you said, nothing to worry, you're going to be fine. And you really did put me at ease. And then I remember asking you, as you were, I guess, making your marks, I said, are you sure all of this is going to be gone? Because I couldn't even imagine what that would look like. And you said, it's going to be gone.
Right.
And you're absolutely
and
right.
It was.
Oh, it's wonderful. Gone. It's gone.
Yeah. Wonderful. So we did the drainless tummy tuck, which I believe you said was the reason why you actually went forward with it, because it was to be able to give you a smoother and a faster recovery. So tell us about that recovery process then with you after.
So the first day or the first evening was probably the most difficult evening, but day 2 and day 3 I started moving around, and of course my daughter, she really got me up and got me walking, and I think that's the best thing that you can do is just to start walking, start back moving around. And day 3, I think I was really moving around. I think I even went to a couple of stores and just got some walking in, and I think that it really made a difference.
Absolutely.
It did, and I've been going from that point on. I just wanted to make sure that I was getting up, moving around, and following, the instructions that I was given. And, the pain, I took the pain medicine maybe 2 days, and then I didn't need it anymore.
That's
but
wonderful.
It's the drainless tummy tuck, not having to deal with those tubes and measuring liquid. That is the thing that will turn a person or have them thinking twice about doing it. This recovery, in 2 weeks I was back at work.
Yes.
I was back at work in 2 weeks.
Wonderful.
And so, I stayed in town because I had day 6 or day 6.
Yes, day 6. I remember you stayed in town, and day 6 we did a short video.
Yes.
And people were thinking that you're much, much further along in your recovery, but no, it was only 6 days. You were standing up straight, feeling well. Of course, there's still more swelling and recovery process that has to take place, but at 6 days, you look fantastic already.
Well, that's because I was up moving around.
Exactly.
I think that is very helpful. And
very helpful.
Helps you with your healing process.
And then you were able to travel back, flying back, so that was no issue. And now 3 months later, you're back here.
I'm back here
in person
again.
Because during that time we did some more follow-ups, virtual consultations, virtual follow-ups, appointments.
Yes,
to make
I sent
sure
my
everything was
pictures
well.
in so that you could take a look and see how I was progressing.
Yes.
And here I am back in person.
And it's so nice to see you in person. It's beautiful. I love it.
Yes, I do too. Always a reason to get away.
Yes, wonderful. And again, the recovery process is fairly straightforward. You came with your daughter. You did not need skilled nursing. You did not need to go to a skilled nursing facility or recovery home. It was fairly straightforward. So that's what I try to do for all of my patients, to make it as easy as possible.
Well, I think that the drainless tummy tuck, if you're on the fence and you really want to do this and you have the opportunity to get a drainless tummy tuck from my doctor, I would certainly encourage you to get off the fence and come and visit.
Now, tell us how, I know you had been wanting to have this done for many years. Tell us how this surgery has affected your life.
Just shopping in general, before the surgery, you look the way that you shop for clothes that maybe can camouflage the areas because you're not comfortable with the excess skin. But now, oh my goodness, it's like there's nothing off limits. If I see a dress that's fitted, I'm comfortable at least trying it on now and seeing what it looks like. Before, it was just pass it on the rack, because you want to camouflage those areas. But this, again, has been a life-changing decision for me. And I'm so glad I did it.
We're very grateful. And would you do it again?
In a heartbeat. Again, like I said, the only thing that I regret is that I didn't do it sooner. Didn't do it sooner. That's the only thing.
Yes.
But I would have had to have you too.
Absolutely. Thank you. Before we wrap up, what advice do you have for any women out there who are looking to have plastic surgery?
That's probably in my age group.
Yes, in your age group.
In my age group, I would say that really consider the time, or really consider how long you've been thinking about it. And the drainless tummy tuck, again, that's a game changer. And if you are concerned about the recovery time, it is the drainless tummy tuck that's a good fit. It was a good fit for me. And I would just encourage you, go after what you've been thinking about for many, many years, like I have, and you will see that you will be glad that you did. It's life-changing. It really is, in so many areas.
Yes.
You put on an outfit and you see yourself in the mirror and you just, is this really what I look like?
Mm-hmm.
You know, because you've seen yourself the other way for so many years.
Right, and that does. Thank you so much. That's some really good advice. And you're right. It does take time for you to adjust to the new you, but it is you, and it's beautiful.
Yes.
Yes, and I'm so happy. Thank
I
you so
am
much.
happy. Thank you. Come and see the doctor.
Well, thank you very much for sharing your time with us, and we wish you a safe travel back.
Thank you.
Okay.
Thank you very much.
All right. Take care. God bless.